Welcome to our presentation on juvenile diabetes. This is a growing issue in the United States, and in this video we will help you to understand the difference between type 1 and type 2 diabetes, the signs and symptoms of diabetes, risk factors, and how each type is treated. This presentation is provided by Aaliyah Southfield, Amber Egbert, and Kaylee Watson. We are all registered nurses. Let's start off with type 1 diabetes. This is sometimes referred to as early onset diabetes because it is typically diagnosed in children, adolescents, and young adults. Type 1 diabetes occurs when the body doesn't produce enough insulin, and insulin is what allows the body to use the glucose or sugar from our food as energy. Here's a depiction of a healthy individual. The pancreas produces insulin, and this insulin allows the glucose to be taken into the body cells for use or storage. Over here we have a diabetic individual. The immune cells attack the pancreas and cause it to not be able to produce enough insulin. Then when there is glucose or sugar in the blood, there's no insulin to take it into the cells. So the insulin isn't there to take it in, and the glucose stays in the blood system, causing a high blood sugar level. The risk factors for type 1 diabetes are as follows. A family history of diabetes. This is especially true if the child has a parent or a sibling with diabetes. The next is genetic susceptibility. This goes right along with family history and has to do with your genes being susceptible or easily affected to cause type 1 diabetes. A viral exposure is one of the many common things that starts the type 1 diabetes, especially if somebody is genetically susceptible to it. So when a virus enters the body, the virus or the immune cells that are trying to attack the virus attack the pancreas, which damages it, and then insulin is no longer produced. Low vitamin D has also been correlated or found to be common in diabetics with type 1 diabetes, but no real cause for this has been discovered. Let's move on to signs and symptoms. These signs and symptoms are for both types 1 and type 2 diabetes. Extreme thirst. This doesn't just mean they're drinking more than usual. It means they're drinking constantly, all day, every day, a lot of water all day long. Sudden weight loss is very common because the body cannot use glucose as energy, so it tries to use fat as energy, and that causes a frequent urination is another thing that occurs. This has to do with, again, they're drinking a lot of water, but it also has to do with the glucose levels being high causes glucose to go into our urine to be excreted that way. Blurred vision is common. Extreme tiredness. This has to do with the body not having enough energy. The glucose that is in the body is unusable due to the lack of insulin, so there's a lack of energy, and that causes the feeling of tiredness. Mood changes is also common. Constant hunger is something that many kids will complain of with type 1 diabetes. Their body doesn't have the energy it needs, and so it produces the feeling of hunger to try and to get more energy from more food. Vomiting and nausea is common. Infections is common. The body's just not operating at its highest level and thus can't fight off those infections. Tummy pains are a common complaint. And acetone smelling breath. This does mean that the child's breath might smell like nail polish remover, and it's from the body trying to use the fats as energy. When the fats are broken down, that can cause the acetone smelling breath. Treatment of type 1 diabetes starts off with monitoring your blood sugar level. So here we have a blood sugar monitor. So you prick your finger and put a small drop of blood on the monitor, and it reads out and tells you what your blood sugar level is. Next, to manage it, you need to eat healthy. You need to eat well-rounded and monitor the amount of sugars and carbs you're eating so you know how much insulin to administer. Regular exercise is important for all people, and that includes type 1 diabetics. need to make sure and exercise daily and to balance out the sugar and insulin in your body. Insulin injections is the only way to truly treat type 1 diabetes. The body is not producing any insulin, and so you have to provide synthetic or man-made insulin to the body. Here on the left we see a regular insulin syringe. The insulin here, we have two kinds being shown, is drawn out of these vials into the syringe and administered either in the abdomen or the stomach, the thighs, or the back of the arms. Here in the middle we have an insulin pen. You dial in how many units of insulin you need based on how much food you ate, and then you remove this cap down here and administer the shot either again in your stomach, your thighs, or the back of the arms. On the right here we have an insulin pump. This is a needle right here that is inserted into the abdomen and then left in for a time being, and it runs along, goes into the pump, and in here is kept insulin. You tell your monitor how much insulin you need, and it administers that through this needle. Moving on to type 2 diabetes now. Type 2 diabetes occurs when the cells in the body become insulin resistant. So in this instance, the body is still producing the insulin, but the cells are not letting the insulin do its job. So if you think of the cells as being a lock and insulin as being a key, what's happening is this insulin isn't working anymore. It's the wrong size, it's just not fitting in the lock, is not letting it in, and the glucose is not being taken in. So here we have another depiction of it. We've got the pancreas and the stomach. The food is taken in, it's broken down into glucose. So glucose enters the bloodstream, and then because due to that, the pancreas will release insulin into the bloodstream, but the insulin is not able to work to let the glucose into the cells. The glucose remains in the bloodstream and causes a high blood sugar level. So the risk factors for type 2 diabetes are a little different. Again, having a parent with type 2 diabetes can cause a child to be more susceptible to it. The next two risk factors are what we call modifiable risk factors, because there's something we can control, there's something we can do about them to make it so they don't cause type 2 diabetes. And those are being overweight and living an inactive lifestyle. Type 2 diabetes is such a big deal right now because in America, childhood obesity is on the rise. And when kids are inactive and they're eating chips and soda and candy all day long, then they become overweight, and that can cause type 2 diabetes to develop. So preventing type 2 diabetes is possible by doing some of these simple things. So the most important thing is a healthy diet and regular exercise. So a healthy diet would include eating whole grains and breads, fruits, vegetables, and lean proteins, and limiting the sugary foods and beverages. And of course, encourage increased physical activity. Get your kids up off the couch, get them moving, get them outside playing, doing something. Treatment of type 2 diabetes is a little different. Taking medications, sometimes they are prescribed. These medications work differently than insulin. They're not insulin. The body is already producing insulin, but it's just not using it. So these medications help the body to use that insulin. However, medications might not be needed if you're able to manage it with a healthy diet and exercising. So the healthy diet means limiting the sugar almost to nothing, watching how many carbohydrates you're eating, and making sure you're eating a well-rounded diet. Exercising is important to maintain your body weight and to lose weight. Sometimes type 2 diabetes is thought of as being reversible as you lose weight and your body is able to handle the sugar levels in your blood. Like I said, being active is very important to prevent it. So it's best to just think of getting up and moving at least 30 minutes a day. This doesn't have to be going to the gym. This doesn't have to be, following an exercise video every day. It can be something simple like walking the dog, having a dance party. I know this is something my kids love to do as a family activity. Riding your bike, playing catch outside, or joining a sports team. They're just a few ideas, and you might have your own way of getting your own kids up and moving. Healthy snacks are super important. Kids gravitate towards sugary snacks like candy and soda and chips, but these are some ideas of things to replace them with. Nuts and trail mix, fruit, either fresh or dried fruit, whole grain crackers with different toppings on them. We like to have ours with cream cheese on them. Celery with peanut butter on it. We also like to put ants, is what we call it is ants in the log, and we put celery with peanut butter and raisins on top. Light popcorn is another option. String cheese stick, peanut butter sandwiches, or yogurts. These are just a few of many healthy snacks that can replace the sugary snacks. Hope you've enjoyed our presentation. If you have any questions, comment below, and if you have any ideas, please let us know. Thanks.